Welcome to my channel Sultan Technical. Hello friends, how are you? Today our topic is health insurance in US system. US health insurance system. How does the US health system work? Healthcare in the United States is organized in a complex bureaucracy, while in the rest of the world healthcare facilities are owned mostly by governments or by private sector businesses. In the US, a large share of hospitals and clinics are owned by private non-profit organizations. Yet the United States is the country that was the highest healthcare expenditures in the world. While these expenditures are covered in a large share by public payers as by federal institutions or state and local governments. They can also be covered by private insurance and individual payments. At the same time, unlike most developed nations, the US health system does not provide health care to its entire population, as there is no single nationwide system of health insurance. The United States primarily relies on employers who voluntarily provide health insurance coverage to their employees and dependents. In addition, the government has programs that tend to cover healthcare expenses for the fragile parts of society as the elderly, disabled and the poor. These programs differ from one another and all have specific kind of people that are subject to getting insurance in US is not easy thing. Someone may think that once you have money everything is easy, but in fact things are a bit more complicated. One must be very careful and look out to pick the right insurance. Health insurance in United States for non-citizens. The United States government does not provide health insurance for all its people, and health insurance is not obligatory for those living in the US. It is optional but highly recommended and necessary since health services are very costly, more than in any other country anywhere across the globe. These are types of health insurance in US: private and public. Most people use a combination of both. The US public health insurance are Medicare, Medicaid and Children Health Insurance Program. Travel insurance for visitor in USA. Health insurance for international students in USA. These are the insurances. Medicare. Medicare is a national health insurance program that dates back to 1966. It provides health insurance for US nationals older than 65 years old, but also for younger people with end-stage renal disease, ALS and some other disabilities. Data shows that in 2018, Medicare provided almost 60 million individuals with health care in the US, over 51 million of which were older than 65. Medicare program is divided into four parts. Part A, which cover hospitals, skilled nursing and hospice services. Part B covers outpatient services including some providers services, while inpatient at a hospital, outpatient hospital charges. Part C is an alternative called Managed Medicare, which permits patients to select health plans with at least the same services coverage as Part A and B, often the benefits of Part D, and an annual out-of-pocket spend limit which A and B beg to sign in this part. One must sign in Part A and B first. Part D covers mostly self-administered prescription drugs. Second is Medicaid. Medicaid is a federal and state program that helps people with limited income and resources to cover medical costs while covering benefits normally not covered by Medicare, as nursing home care and personal care services. It is the largest source of funding for medical and health related services for people with low income in the United States. Data shows that the US provided health insurance to 71 million people with low income or disabilities, which is 23% of total of the US population. Children's Health Insurance Program, formerly known as the state's Children Health Insurance Program. This is a program that covers with health insurance children of families with modest income that are not low enough to qualify for Medicaid. The Affordable Care Act, Obamacare. The Patient Protection and Affordable Care Act is a federal statute signed into law by President Obama, which made it mandatory for every citizen to have health insurance or be penalized. The act subsidies for low-income families by taxing health care providers and high-income families, as it was designed to lower health care costs while providing better health care for Americans. The Affordable Care Act allowed parents to add their children up to age of 26 to their policies in a bid to have younger healthy people paying premiums. It also allowed poorer people to get treatment for chronic emergency room. US private health insurance. There are about 1,000 private health insurance providers in the US, with each of them offering different plans with different prices, which largely depend on a person's Medicare history. However, while there are individual plans covering only one person, there are also group plans targeting families in particular. Usually, there are three types of health insurance in the United States. Traditionally, fee-for-service health insurance plans, which plans are usually the most expensive that those with an income lower than the average income in the US have difficulties to purchase. However, these are the best plans as they offer you most flexibility. Health maintenance organizations, which offers a limited choice of healthcare providers, yet it also offers lower co-payments and covers the costs of more preventive care. They are evaluated and accredited by the National Committee for Quality Assurance. Preferred provider organizations, which just like HMOs offer lower co-payments, but they give you more flexibility when selecting a provider, as they give you list of providers among which you can choose.